Cortisone is a real all-rounder. You might have even used this medication yourself before, perhaps as an ointment for a skin rash or as a spray for asthma when you're having trouble breathing. Cortisone is an excellent anti-inflammatory, but it can do much more than that, namely destroy tumor cells in the blood and bone marrow. That's why cortisone is absolutely essential for treating the most common types of leukemia in children: acute lymphoblastic leukemia, or ALL for short. In fact, treatment for ALL begins solely with cortisone. In the best case scenario, only a short time later, hardly any leukemia cells can be found in the blood or bone marrow. But cortisone alone isn't enough to completely cure the disease. That's why you or your child will receive cortisone in addition to chemotherapy. This is usually administered in tablet form and over the course of several weeks. Cortisone is also frequently used in cases of brain tumors, often even before surgery takes place. This is because tumor cells can cause fluid retention, which makes the brain swell and increases pressure inside the skull. And in some cases, that can even become life-threatening. Here, cortisone ensures that this doesn't happen and that the swelling goes down. So in this case, it's mainly used as an emergency treatment. But what exactly is this miracle drug cortisone? Well, the cortisone you receive in the hospital is synthetically produced, but it's actually a hormone that the body can produce on its own. So it's a substance produced naturally by the body. And this natural substance is called cortisol, not cortisone. And it can be used in a wide variety of ways in medicine because it activates many different processes in the body. Cortisol is also known as a stress hormone, for example. You may have heard of it, because it gives us an extra boost of energy when we're under heavy strain. Then our body, or more precisely the adrenal cortex, produces especially large amounts of it. And that also explains why people often experience constant cravings during long-term cortisone treatment. The body thinks it's under stress and now needs a lot of energy because there's a high level of cortisone circulating. So it holds on tightly to its energy reserves and instead demands more energy intake. Basically, it says, "Come on, give me something to eat." That's actually pretty clever. But in this case, it can also come with some downsides. As a result, in addition to the excellent effects of cortisone during long-term use, there can also be side effects, such as weight gain from eating so much, high blood pressure, a rounder face, or elevated blood sugar levels. An excess of cortisone can also have negative effects on the bones and lead to a loss of bone mass. Experts refer to this as osteoporosis. In addition, mood swings may also occur. For example, one might feel irritable or down. It can also lead to slower wound healing and changes in the skin. The skin becomes thinner, more sensitive, and may appear blotchy or reddened. However, the side effects I've just listed usually go away once the cortisone is discontinued. If you have any questions about cortisone and its side effects, you can of course talk to your team at the ward anytime. And if you or your child are feeling a bit down, it can sometimes help to focus together on what you have already achieved. In other words, try to shift the focus to the positive. Even if it's just that you've made it through another day and are one step closer to the goal of getting healthy again.